Afternoon, everyone. For the sake of time, we'll go ahead and get started today. Welcome to our first ever TriNetX Database Basics webinar, which is part of the CTSC sponsored Big Data webinar. This is all for Q2. Today, I'll be joined by Dr. Craig Jarrett, who's currently tied up in a surgery at the moment, which does happen from time to time. I'm Dr. Ashley Hughes. I'm an associate professor over with Metro Health's Population Health Research Institute. We'll go ahead and get started by going over the agenda today. So to go over and touch on some of the basics for TriNetX, we'll spend some time, first of all, just obviously you're here because you have an interest in big data. There are many different types of big data sets. We're covering TriNetX today, but there will be other webinars and other events that have to do with the Epic-sponsored Cosmos big data data set. And so this year, sharing some very preliminary details that we have for the second, hopefully annual event of the Cosmos Datathon. We'll talk about just an overview of TriNetX. We'll talk about some logistics for how you might be able to access that, who can access it, the process of actually getting started. And then, of course, we'll like to save some time for a live demo that will cover how to build some basic queries. And we have some example research questions we'll use to do that. So for future events, so on your calendar, if you like today's webinar, if you think that you might want to use TriNetX and to answer some of your own research questions or to use in your own research, or if you're a student looking for a project, stay tuned for our next Big Data webinar, which is scheduled for August 20th. Same time, 12 to 1. Where we'll cover some slightly more advanced topics and queries to build off of today's webinar. Also, it's been announced we are still in the process of setting a date. Sometime early fall is what we're thinking, but for this second annual multi-institutional Epic Cosmos Datathon. And we'll continue having this big data webinar series through Q4 of the CTSC project. So to give you an overview of TriNetX, what is it and what can you do with it? First of all, it is a massive data set. The number of actual patients, we'll talk about this with some of the pros and cons of using TriNetX. And I see also we have some TriNetX experts here with us today in the audience. But it covers about 275 million patients. Covering 120, actually, last I checked, it was 127 healthcare organizations. Multiple countries are involved in contributing to this large data set. And you actually have a repository of different types of data that you can access. So this can be clinical observations as well as some genomics data and claims data. So to dig into this a little bit deeper about what exactly is in the TriNetX data set, you can look at the data source breakdown over here that we have electronic medical records, medical and pharmacy claims, along with some linked EMR medical and pharmacy claims. And this covers VA data as well as commercial and Medicaid, Medicare. We do have some longitudinal ability to query TriNetX data. And there are lots of different types of measures. You can just see a snapshot of that over here for the measures that are available to query. So I do like to give some caveats to this, especially when you are, there's an article that we include at the end that I strongly recommend reading if you plan on using a big data set like TriNetX, that you really need to better have a firm understanding of what it can and can't do, of some of the limitations of a data set, especially when you're dealing with big data, that you are able to come to accurate conclusions with what you're saying, given the power of big data. But you are talking about a limited de-identified HIPAA compliant data set. So what that means is that you don't have to necessarily go through an IRB approval process in order to run your queries or perform research using TriNetX. That this is de-identified and stripped of any identifiable information. It's free to access for individuals. And, the caveat to that is that you need to be employed or be able to have access through your institution. Institutions have to contribute data to TriNetX to get access to this network. And, you know, fortunately, it's not just for student projects or doing grant funded research. You can absolutely publish using this data as well. So even if you just have a question that you've had for some time and have been looking for the right data set to perform that research with, TriNetX may be the right data set for you. However, caveats in mind, TriNetX is not data that's for sale. It cannot in any way, shape, or form be re-identified. So kind of to that fourth point that I have listed here, that makes it a little challenging or complicated to try to link to other outside data sets outside of TriNetX. If you want to connect with myself or Craig, we can talk through you can work with the company to try to link it to other data sets, but it's not a straightforward process whatsoever, in part because it cannot be re-identified. But also, since we're talking about secondary use of data, it's not suitable for all research questions or projects. So some of the types of queries that you would and reasons why you would want to use TriNetX is that you can design protocols and you can assess for feasibility before digging deeper into a particular project or question. So, if you are interested in a more rare disease or don't know prevalence of something, you can begin an initial query to look at what that patient population might look like. Profile certain target populations. You can look at demographic information at a high level, very similar to Cosmos Slicer Dicer. Now, differently from Cosmos, if you have some familiarity or interest in that, you can actually do some analyses within the TriNetX platform. So it will allow you to do some comparisons between cohorts or look at things over time based on your criteria. You can also, using this real world data, look at how certain medications are performing or try to validate some findings across multiple networks. There are built-in sort of research networks within TriNetX that you can more readily access through the platform. And we'll give you a brief overview of what that platform looks like here in just a second. But first, before you're able to do any of these types of queries yourself, you need direct access. So at the moment in the Cleveland area, the main go-to providers for TriNetX are Metro Health and university hospitals. If you are with university hospitals, this is how you get access. You can scan the QR code, or I believe these slides will be made available afterward. You can go to this red cap link. If you need additional support, there is an email address down below. If you're at Metro Health and you're directly employed by Metro Health, you just put this in as an IAM request. And that is done through the Metro Health main intranet site. For additional support, or I'm anticipating some people may have questions on how to get access to TriNetX, and it is a little bit complicated if you're not part of one of these networks, but feel free to pop your question if this is a question that you have. Feel free as you have questions to pop it in the chat. But I'm happy to discuss how else you might get access as well. So we can begin now with a bit of our live demo, and our first one being, how do you log in and how do you get started once you have a TriNetX account? So assuming that you are at Metro Health and or university hospitals, you go to the live.trinetx.com. You'll see here that it's going to pre-populate with my information. That's just how I have things set up. Depending on also, interestingly enough, which institution you're signed up through or which institute gives you access, it may have you go through your authentication process. So I'm going to go to my TriNetX home. So this is your home page or your landing page. And also I just want to make sure, are you guys able to see my website? It should be my browser that's showing now.
Yes.
Okay, good. I wanted to make sure it's showing correctly. So yes, and yes, I can absolutely drop that in the chat. Let me do that right now before we go any further. Yes, so it's done as what is known as an IAM request, and I will drop my Metro Health email in the chat because I also had to ask some questions like what is an IAM re request? But you can also contact David Kalber and or Yasser Terabici, who can also grant access through Metro Health, but it will have to go through IAM since Metro Health is transitioning to a single sign-on for all data platforms, including, Epic. Okay, so for getting started, this is our main landing page, and you can see other studies. You can actually share other studies with your collaborators so that you can share your queries and get feedback on things. This is like a student that I'm working with. So when we're beginning something from scratch with a new login, you go to create new study. And for today's purposes, the example, we're just going to call it query one. But you have to give a study name. Anything that is required is going to have a red asterisk next to it. You see that this is mainly for internal purposes for TriNetX reasons. They just want to know why people are accessing their data. It doesn't necessarily impact anything other than you have to give an answer. So we're just going to say conduct other secondary research since the queries that we're going to do today don't fall cleanly into these other categories. You can give a summary if you'd like. It can be nice to kind of track these things. You can do sponsored research through them. They do require a primary therapeutic area, as we're going to be doing for those of you who have attended our past Cosmos big data webinars. We're going to be replicating those same initial queries in TriNetX. And so anyway, that's going to fall under cardiovascular diseases. Over here, you have the option, if you know off the bat that you're going to want to share your TriNetX query with someone, you can click here. But as Craig will also share with us, you can add people onto your study later if you forget or the need arises later in your study. Okay, so that gets us over to where you actually begin building out your query. Now, with any database, it's fairly important that you specify your criteria based on what it is you want to know. And in order to do that, so queries that are performed with TriNetX, they're going to primarily rely on your ICD-10 codes, since some of these are international. ICD-11 codes can also be queried as well. You also have CPT codes. There are many different ways to specify your search. But let's just go to some of the resources that are available. So there are data dictionaries that are updated periodically through TriNetX. And so I'm going to just come here where there's always FAQs in the TriNetX Help Center. So I see that the most recent one was updated June 2023. So we're going to just click on that link and it takes you directly to the data dictionary, which is nicely spelled out. You can look at different tables, different data overviews, and it's clickable as well. So you can just always go to what you might need. Go back to slides here. Okay. And at this point, I'm going to actually turn it over to Craig, who's going to do a live demo of walking us through what a query looks like, what performing a simple query actually looks like in TriNetX. So a little earlier than planned, Craig, but
A lot earlier, huh? That's okay.
yeah, a lot earlier. Yeah, we
We can.
really anticipated going over spending more time on some of these things.
Are there any questions so far? Okay, if not, we'll jump in. So let me just peek on this
And
query.
yeah, I am happy to make the slides available to you separately. That way you have the contact information and some of the links, including like to the data dictionary. Craig, while you're pulling that up, I can go over some of the research questions that we have as well. Also, you're welcome to take down my email if anything comes up, or are you ready to start sharing? Or you are
Do you
sharing?
see, yeah, which screen do you see? The main TriNetX screen?
Yes.
Okay, great. So Ashley showed you guys how to log in and how to initiate creating a project, and then we're going to do some now queries. I have some queries from before that we've run because it really depends on the time of day. Not only that, but like weekend, weekday of how quickly these queries run. And so we do have screenshots. We've learned from prior big data webinars that we can't always rely on it running as quickly as it does, when we test it. So in one of those three, we're either going to do the query, you'll see the full thing. We'll do the query that I've already done, or we have screenshots. We'll get to answering the specific questions. All right. And Ashley, I'm going to have you just pull back up the
Yeah,
search questions.
of course. And I just dropped those in the chat too, Craig, just so that people can reference them as you're doing the actual live query. But I'm happy to go over that. So our
Just pull
specific,
your thank you. And
yeah,
so the research questions we have, these are very similar to the research questions. They're identical to the research questions we use for Cosmos. And this way, we wanted you to be able to see where Cosmos may be better, where Cosmos may be worse. I only changed the date. So before we were June 2024, now we're June 2025. But these are our research questions. And these are very simple. This is why it's the basic kind of introduction is the research questions we have are what was the prevalence of hypertension in adults by race in the US from July 2017 through June 2025? Very, very simple query. It's one population, right? We're not really comparing groups per se. And then just to kind of dig down a little bit further and see some of uh, the additional features, you can look at the trend in the prevalence of hypertension and looking at it by year and by quarter. When we did this in Cosmos, this is one point I'll show that it's very easy that one particular piece in Cosmos just to do by year and quarter. They have those filters kind of built. In TriNetX, you have to kind of build those yourself. So the terms to be familiar with in TriNetX, and there's a corollary to Cosmos, is how do you define your study group, right? If you think big picture, your table one, how do you get those patients defined in a data set? And so that is your inclusion and exclusion criteria. In TriNetX, we use the query builder to define those. The must have, of course, the inclusion, the cannot have, or of course, the exclusion criteria. And then once you've defined that, you then go in to explore the cohort. That is really just getting to know the cohort. The explore the cohort and the summary statistics are defined by the TriNetX team. And so they may or may not be what you need, but it allows you to kind of dig into the data set. And then if you need additional features, you can add those in. And we'll show you some of that. And then the last piece is the analytics. That's where we actually get to okay, what is the prevalence by race? And we'll show you all of those features. All right, I'm going to take this screen back. And so, great, that's run. So to get to our query, you can go to see all studies. This is the one that I had created before, but we're going to kind of just start anew so you guys can see the full process. I'll just call it data webinar 2. And Ashley already showed you this. You just select the area and we're going to do this. And that's just easy. And I'll show you how to get back to, if you want to add change, if you don't like what you named it, it's as easy as going to the study management tab and in hitting edit. And so the things I just put in, and I did it again just to show this, you can change right here. And this is as as your study progresses, if you want to add on and share this study that you've made with team members, you can go here. So if you want to, you have to search the person and drop them in, and then they will see this. You can also upload documents. may or not be helpful, but if you're sharing the project, maybe it is helpful. Anyway, that's how you dig back into when you create your study. As described, so the query builder is where the magic begins to happen. You have to define your study cohort. And so we're keeping this super simple just because you really need to get in to TriNetX and play around with the interface. You'll see there's some quirks, just as there was with Cosmos, but that's the best way to learn it. And so to define our study cohort, remember our research question is, what is the prevalence of hypertension in US adults and from 2017 through 2025. And so the first thing you've got to think of like the population, the broader scope, what is available to you. And so there are a number of different data sets. There's the global one, which of course has the most patients, 181 million currently. And this number ebbs and flows depending on who joins, who may stop sharing data with TriNetX. And then there's also this the one I'm on, which is the Research USA, of course, the United States, and minimal date shift. And Ashley mentioned that as one of the potential drawbacks of TriNetX, or something to keep an eye out for. They've recreated this data set based on feedback from the Metro Health group, especially Dr. Kelber, that if you're studying something like a pandemic, you really can't have up to a year of date shifting. And this was initially discovered because they found COVID variants in the United States before those COVID variants were even in the United States because of the date shifting up to a year. So this is minimally date shifted. It's up to 30 days, which is helpful. And that's what Cosmos uses. So it's for that piece, it's on par. There is not a global data set that's minimally date shifted. So just for global pandemics, COVID, it's challenging. Anyway, so the inclusion criteria are the must-have, exclusion criteria are the cannot have. And what we're looking at is similar to Cosmos, we want patients, not that are just known, but are actually followed, right? So if you're determining the prevalence of a disease, you need to make sure that they have some sort of regular interactions with the healthcare system, or you're undercounting, right, by definition. And so what Cosmos uses is you have to have 2 visits within a 2-year period. And if you do that, they've done that work for you, you're considered a base patient. There's a similar feature in TriNetX. You just have to do the work. You define what you want a patient with adequate follow-up to be. Most people who've done TriNetX studies and what's published is you just search, and this will show you all the different features, but you search for a visit. And what that means is that there has been some sort, epic lingo is encounter, the agnostic, EHR agnostic term would be a visit, but that patients have had a visit in a specific defined time period. Again, you can define it as 2 visits within a 2-year period. That's what Cosmos uses, but that's what Cosmos uses, right? You don't have to. Most people just use a visit within the time period. So we want that. We want to start off, we want patients with a visit. This is the population as a whole. And remember, we're trying to determine prevalence. So if you may think, well, why aren't we getting patients with hypertension? Remember, if this is inclusion and exclusion criteria. If you only include patients with hypertension, you don't have the denominator for the prevalence. So you just have to kind of think through that. And again, I can't state this enough. Getting into TriNetX and playing around will help you figure that out. It will force you to. And so currently, our query builder is just patients with a visit, but that could be a visit in any time period. So we need to define that. The other piece we need to define is the age. We want it specifically to look at adults. And so again, it's learning the tool. It may or may not be intuitive to be in this location, and I'll show you some other things that you may not think that's where you would find them, but that's where they are, and you just have to learn to use them. And so here are the filters specifically for if you want to look at medical center. And these are things like, is it academic, non-academic, or unknown? The data, what type of data we're using, and specifically, we're not going to, this is, remember, filter. So if you're thinking of, you have everything, the universe, what are going to filter it down to? We don't want to filter it yet. We do want to filter the age. And so currently it's any age. You can flip on this and it will show you kind of the demographics of this population. And here you can put in, we're going to define adults as anyone who is 18 years or older, and that is inclusive. And so you can see that these are now kind of now excluded. And so again, wrapping your head around inclusion, exclusion criteria, you can either include something or you can exclude something. You don't need to do both. So we don't need to, exclude children. We've included only adults. And then the piece now, so we've currently now defined it as adults, defined by greater than 18, with a visit. That's it. And so we really want that visit to be within that time period that we're looking, because that's when we want to determine the prevalence. For that, you have to create a group. Again, we're only creating one group here, but that is the way TriNetX is built. And you can go to this group rules. This is where I mentioned, like, it's not super intuitive the first time you use it. And that's not a dig to TriNetX. It's just, it's pretty complex. And to try and this isn't it's not an Apple, device that it's streamlined. And so here we're going to make specific dates, and you can just type it in, or you can use the calendar feature. And we said that we wanted July of 2017, and we're going to just say through the current date, which is essentially most of June. And now we have adults with the visit during that time period. And that is, if you think about our patient population, that is what it is. And so now we're going to, the equivalent in Cosmos would be to do a slice, right? We want to determine how many of those patients have hypertension. And then we subsequently want to determine how many of those patients with hypertension by race. And so it's a couple slices in TriNetX. It's not, they're not called slices. It's actually criteria and then a strata, and we'll show you that. And so now you hit count patients. This kind of finalizes your query. It is good practice to name this something. So we can say adults with hypertension, something like that. You can do whatever you want, but it's nice because you can go back and you don't have to, you can keep them all on name, but then you have to, when you go back, you have to open it up and see what you actually queried. And so this is going to count the patients. We may or may not wait. This is where I give it a couple seconds and see how quickly it's going to run. If not, we'll jump over to the query builder that I did before. So it looks like it's counting. When I did this before, so you hit that button and it ends up with 88 million something patients that are in the US, adults, and have a diagnosis of hypertension. So we'll let that run.
If I can jump in here, Craig, I just want to show, oh, you know what? Actually, it's still running, but it will tell you, it was giving us a message saying that one or more sites did not have patients that met your criteria. So it will tell you if if, you're, I was hoping
So
we could,
now,
it will tell you when something is missing.
now that that has run and we have our total number of patients, you can do the explore the cohort. And this is where they've defined what they think you want to know. And again, it runs pretty quickly. The last mile is the most time consuming. You can stop and view their partial results, or we can jump over to the query I already did. And what you get is this. And so you get, again, this is what they've defined, they think you want to know. You get basically, you get sex, you get race, and you get kind of the spread in the ages. Uh, Whether or not you want that or not, you can play around with the graphics. It just sets the stage to determine, based on your inclusion exclusion criteria, are you going to have enough patients to look at? Clearly, we didn't make it very sophisticated for the first round, so we have plenty of patients. There's the standard demographics as you would expect, and it seems to be, representative. And that's you can then go down into TriNetX. Basically, they break it down, and I think it's how most people think in medicine, but define the patient, the demographics, like who are we talking about, and then what diagnosis do they have. Oncology is a little bit of a separate thing, but there's an oncology tab here, and we'll run through these quickly. The reason these are defined is it's simply a filter, and it bubbles up the most prevalent to the top. So the diagnoses, and these are based on ICD-10, you can change it if you don't want ICD-10, and you can change your times. But the most common is it's very vague, but this R00 through R99. And this is a huge range. There's a ton of diagnoses in here. As we all know, ICD codes are hierarchical. So there's probably over 1,000 different actual, discrete diagnoses in this data, in this one big bucket. And you can do that, and it will actually show you. So these are collapsible. It's kind of nice. You can look through, and you keep going down these rabbit holes, and you can just start to look at what these patients have. Again, this isn't how we're defining our patients. This isn't defining the groups after we've defined the study groups, and it's not defining the individual arms of your study group. It's just getting to know your data set. And again, the most common at the top. Oncology, it digs more into the diagnoses specifically for cancer, gets into staging, histology, you can see here. Procedures, most common procedure is evaluation management. Well, what is that? Right. And so you can start digging down into these. So 62% of this entire cohort has had an evaluation management. Well, that's great. And then you can start digging down what is the most common evaluation management. It's an office or other outpatient service. And again, established patient, new patient, and it's just getting to know the patients. A specific medication here that you want to look at. You can look here. Labs, it's all the same. And so most common lab is a basic metabolic panel. It's the sodium, potassium chloride, bicarbonate. They're all 37, 38%. And so that's what I would expect. Anyway, and then genomics. Genomics is new relatively to TriNetX. It's not well populated. As you can see, there's only 33 patients out of 92 million that have an ERBB2 gene mutation. So being built, it's good to see, but not a ton there currently. After you've defined your cohort with the query builder, you've explored it, and this is the same thing I would do in a study. You've defined your cohort. If you work in R, you'd use something like a describe from the dplyr package. You can do a head, right? Look at the top 5. It's really the same way you would think about it if you're doing the analysis yourself. The next step then, after you have done your query, you've explored it, is you can look at summary statistics. And so this one is actually finished. It changed because in this query, I don't think I had just adults. So this is adults. That's why it's 78. I'm sorry. Yes, this is why it's 78 million. It's fewer. And then now we can look at the summary statistics. Again, this takes a minute to run. We'll let that run. We're going to jump over to the one I already ran. And this is, again, these are defined by TriNetX. It may or may not be something that you find helpful. It's not a full table one, but it gives you some sort of gist of what's going on, the average or the number of diagnoses, right? The number of procedures. These are unique, right? Procedures, the number of unique medications, labs, et cetera, et cetera. And you can define here what part of what region of the United States. And so, nice to look at, not super informative, doesn't really answer our question yet, but it's just getting to know the data set. And that's still running. So I may cancel this just so I can show you the next step, which is what we're actually trying to do, which is get to the prevalence. And I think we'll stop that.
Do you want any screenshots, Craig?
No, I have it already ran. I think that'll work fine, but thank
Okay.
you.
Mhm.
And so now, again, I've run that one. I'm kind of duplicating it here. How do you get to like the actual research, or the actual answer to the research question? Once you've defined your cohort, you've explored it, you have some descriptive statistics. Those are kind of one and the same, slightly. And now you can do a new analysis. And so these are the analyses that TriNetX offers. You may or may not see what you need here. Again, the best way to determine whether or not you need or whether this works for you is to get into the system. But you can probably see that this is actually more of an offering than what Cosmos has. So again, we're going to, throughout these webinars, and when we're done, introducing TriNetX fully, going through an intermediate and an advanced topics, we're going to pit Cosmos versus TriNetX with a various bunch of different studies, and we'll show you what to use when. And so, again, there's more features here currently than is in Cosmos Slicer Dicer. I'll be specific. So there is what's called Cosmos Data Science Virtual Machine, where you get access to the row level data, and then the sky is the limit, right? But you need to know how to do SQL queries and code in Python or R, and that's not what we're getting into now. We can definitely do that for a subset of people who are interested in that, but not the focus. So we are going to stick with this one right here. It's, again, it says incidence and prevalence. Why not? I think that would probably work, but it's pretty helpful. So I think the first thing I think of in a research study is this going to work or not? Do you have a single group of patients, right? Or do you have two groups of patients? So if you look at that, that defines these 3 or 4 single, these, I guess, 5 are single cohorts. These 3 are double cohorts. So that's one dividing piece. And then here, where your index event was. Are you reviewing outcomes? Are you reviewing competing risks? And then are you trying to do something like a survival analysis? And that may get you most of the way there. The other piece we'll show you at the end, which I think we'll have time, is the Q&A, the FAQ, and the training that is offered. And so we're going to jump into the analysis for prevalent incidence and prevalence. We've already defined our study population. And so the nice thing is you can do this, you can create a separate study population and run it in the same analysis by simply just dragging it in, and you can subsequently save it. If you had two groups, like if we did one of those other analytic tools where it requires two groups, like for instance, this, well, then you would drag one and the other and the other. And we'll show that in the intermediate TriNetX seminar or webinar. But for now I have all these unnamed. So if you want to delete them, we're going to go to, or actually, I just want to go back to this one. So this is the one for the incidence and prevalence. I dragged this in. We've defined our population as adults with a visit in the United States with hypertension. And now we're going to go to the inputs. This is where you further define what you're looking at. Again, we haven't yet put anything in there about hypertension, so we know we're going to have to do that at some point. And if you want to review what we've done so far, there's this cohort definition. And so it's just collapsible. This is out of order, but they're adults with a visit. We already know they're in the US because this is the US data set. And then they have to have that on or after July 1st of 2017. So that makes sense. That's what we had defined before, right? That's what we're putting in. And now we want to look at that time window one more time. And so what we've defined currently is patients who've had a visit during that time period. What we want to really know, because we want to make sure that they're followed in the healthcare system. But what we really want to know is, did they develop hypertension during that time period? Did they ever have hypertension during that time period for prevalence? And then at what time did they potentially develop it for incidence? And so looking back or during that time period, did they have an encounter where they didn't have hypertension and they had a subsequent encounter with hypertension? That's, of course, would be incident case. And so here we're going to put same time period. This may seem a bit unintuitive, but because we've already defined it, but what we were defining in that time period was specifically the visit. This is actually going to be the diagnosis now. We're sorry, there was a problem. Okay, we'll see if it runs. We can or cannot label this. This is helpful in the next step, which we'll get to. You can set the look back period, and this is specifically related to mostly the incident cases, right? How far do you want to look back of when they didn't have the diagnosis? Are you looking back all the way back from, because clearly at some point, I mean, unless they were born with it, which is very, very rare, they had to have some sort of incident case at some visit, right, in their healthcare record. We're going to leave that with a default. The next thing we wanted to do is remember our subsequent question or by criteria or slice strata is that we wanted to know hypertension by race, and so we can click that. I'm not sure why it's saying sorry. It tends to get angry when you try and do duplicate windows. I've noticed that. But here I can open up this one. It's the same thing. And so race, and then finally, what is the outcome, right? And so what is the outcome that we're looking at? And these are patients with hypertension. And again, this is you have to be careful how you name things. It can get really confusing. But what we're looking at is just essential hypertension, the most common form of hypertension. That's the ICD diagnosis of I-10. And so we want to look at the prevalence and incidence of hypertension. And so finally, that is the whole query building. And then we're looking at the analysis, and let's run that. We've already run it, so we'll see if that may have to go back and yeah, there we go. This one should already be run. Results. Okay. Well, we'll let that run. While that's running, I'll show you where the FAQs and the training are. We'll come back to that. There it is. And so we're gonna run this. These are two separate queries. All right, so I'm going to show you where that is. And so if you go to the TriNetX, it's under the question mark in TriNetX. There's a TriNetX Help Center. There's training programs. There's a ton of really good videos. They're done by the next company, and they get into very, very discrete questions, how to answer those. There is also the FAQ, super helpful. If you're, for instance, if you wanted to look at the question we're looking at, you could just type in prevalence, see what comes up. And here, how do I start an incidence and prevalence analysis, right? So you can, a lot of times, as you guys know, people have asked these questions before, and it will walk you through it. I found that this piece of it, is actually probably, the training videos are on par with Cosmos, Epic. videos, but the FAQ is I found super helpful because again, a lot of us are asking the same questions about potentially different patient populations, and so those questions have likely been answered. And so here we see our query results, and so you can see the incidence now over time. And so let me go back to the inputs I put in. When I did this initially, I just put in 2017. If you keep adding in dates, this is where you would add in a subsequent time period, and you can add up to 12. In Cosmos, it's simply a button you toggle. You can go from years to quarters to months to weeks. It's that piece is much more simple, but I think it's not that big a deal. Anyway, you can add in as many times as you want. You can put in, of course, you can add up to 12. I take that back, up to 12, but you can add in, for instance, all those years or all those quarters. You may have to do more than one query, but it's up to 12. In the results, here you can look, we did this before with Cosmos and we did it for the entire period and we saw, an increase. You can kind of see an increased prevalence here from one year to the next. I'm not going to put in all the years because that would be painful for you guys to watch, but you can now look at what is the incidence in the year, what's the prevalence per year, and then our research question specifically was what is it by race, right? And they bring in these nice pictures. You can export these pictures directly. You can also export the data directly. And so if you export the data, it comes in CSV files. If you export the images, they're JPEG or PNG, depending. And then if you export the document, it will basically print this screen into a PDF with the numbers and these pictures all in the same file. And so that's nice. You can definitely get much more, comparing to Cosmos, you can get higher level analyses in TriNetX. And I think if you want to go back to our original slides, so our two research questions, I believe we were able to answer. And one slide back, a couple of slides back. There we go. Oh, the research question slide. There we go. And so what was the prevalence of hypertension in adults by race in the US from July? We answered that, right? And then we kind of answered the second question, which was digging a little bit further by year. All you have to do is add in subsequent years. If you really wanted to do it by quarter, you would have to add in each quarter kind of manually. So that highlights one of the differences between Cosmos, but there are a ton. I think we're right on time at 12:50. We had intended to end and save 10 minutes for questions. Any questions or did anything come up in the chat? Let's see. Let's start at the top.
Yeah, go ahead. There are a couple questions in the chat. The first one is Ryan's question about, is IRB approval needed for opening a study in TriNetX? No, absolutely not. No IRB approval is needed. Part of the reason for that is that this is all de-identified data. If you would like, you can still submit for determination of human subjects so that you have a record on file with your IRB. You can do that, but this is all de-identified data, so no need for involving IRB. And I see a question from Caitlin regarding if we can compare more than two cohorts at a time. And Craig, I'd like to know your thoughts on how to answer that question. But a few ideas come to mind for me.
Yeah, so if we go back to the analysis, and that's probably what screen you're looking at, that analysis screen, it is one or two cohorts. The caveat there is you can, and this is where the IRB is no, but yes, sometimes. And so for any study you do in TriNetX, like what we're doing now, no IRB is required. You can publish it. They do have a thing where they want you to kind of reference TriNetX as expected. And but no IRB is required. If you want to dig deeper into, for instance, your hospitals or maybe the Cleveland hospitals, data, if you want to dig in deeper or link it to another piece of data that's not in TriNetX, that would require an IRB, and that is possible. And so if you wanted to do 3 cohorts, there's a couple ways you could potentially do that. You can export some of these data sets, allow you to export the actual data, uh, and you could export the data for each of the cohorts you just wouldn't be able to use the TriNetX tools. And then, or if it was something, for instance, where you wanted to get deeper detailed data, that you could be exported after getting the appropriate IRB. So no, there is no way to, unless you're doing separate queries, you could do separate queries. And so you can absolutely look at more than 2 groups doing that, right? It's just another query. You can compare 2 groups and then compare two other groups. But if you wanted to do like a 3 group comparison, that's currently not available.
Right. And then you would essentially, like if you're doing just 2 groups at a time, you would then do some corrections to make sure that you're not overly inferring what differences might exist between the groups. So there's just some added steps to that. I would say that, it's possible you can, but there are just some additional considerations. Another thing that you can think of, and I believe we'll get into this either in the next webinar or the webinar after that, is you could also consider, if there's a common thread or diagnosis in some of the different groups, and maybe there are only like 2 main groups. Another consideration is that you can account for covariates in your analysis as well. So if they're not truly 3 groups and maybe 2 groups and you want to control for something that's common between the 2 groups, that could be something to consider too.
Who had the question about the 3 groups? Trying to find it. If you want, if you feel comfortable, feel free to speak up on what the specific research question is, and then we can, or if there are other questions.
Hi, that was my question. I'm Caitlin.
Hi.
Um, I'm working with Dr. Hughes, but I also want to see, Craig, what your thoughts were on the matter. So I think we'll probably talk about this later, me and Dr. Hughes. But I
Oh, okay.
appreciate your
Great.
insight.
Yeah.
Thank you.
Yep.
Did you want to share your research question, Caitlin?
Yeah, sure. So the 3 cohorts I wanted to look at, well, I'm studying transthyretin cardiac amyloidosis in patients with and without aortic stenosis. So my 3 cohorts were going to be patients with aortic stenosis only, patients with transthyretin cardiac amyloidosis only, and then patients with both AS and cardiac amyloidosis. So that's why I was asking that question.
Yeah. So what, I mean, those studies are quite common. What you would do, you get descriptive or summary statistics for each cohort, and when you're comparing them, you're always comparing one versus one other one, right? So it would just be multiple 2 queries, right? So, because what your hypothesis is what I mean, patients with both probably do worse. Is that a guess? Um,
Yeah.
yeah. So I mean, you could easily look at patients patients with amyloidosis and not aortic stenosis, compare those two. The patient with amyloidosis, for whatever outcome, is probably worse. And then same thing, patients without anything, and then patients with aortic stenosis, you can compare those two outcomes, probably worse. And then you can compare amyloidosis versus aortic stenosis, if that makes sense, that direct comparison, or compare amyloidosis or in patients with both. And so it's just it's a bunch of different it would be a much two comparison, multiple queries of two groups.
Yeah, that makes a lot of sense. Thank you.
Yeah.
Yeah, thanks for your question. I see some are about, I've been responding to some of the questions in the chat about IRB approval, recording, how to get access. There any
And for some of you, this may have been too basic, but we're really trying to start from as kind of as basic as we can, and then we're going to build up. You'll see as we get into, I think those who've seen the other prior, some of the Cosmos queries get pretty complicated. We'll do the same thing, and maybe even to cover everything in TriNetX, it may actually be a fourth seminar because there is so much more to offer.
Mhm. Yeah, I totally agree. And, to that, I think I mentioned, yeah, we've got Pauline here, who is actually one of the co-authors of this highly recommended read. With big data comes big responsibility, that actually uses TriNetX as an example platform of considerations that you need to take when you're, trying to make these inferences from big data. Just some, not to say don't use it, but how to really craft and some considerations for your query so that you end up with a usable, data set analysis, and something that can be, more readily publishable, assuming that's your goal. It's definitely a great read if you are thinking to use TriNetX, since there is so much data. The last thing that you want when you're writing a manuscript for this is to make it look like you're doing a fishing expedition for significant results. Because the thing is that when you're using a platform of this nature, statistical significance is pretty easy to find. But you want to make sure that you're using the query in the right way and accounting for, even just some of the things that Craig had mentioned about patient visits, making sure that you're not just reporting noise that may be present in the data. So I'm just leaving that up on the screen, but please chime in if, we're happy to take questions or thoughts you might have, comments.
Great. All right. Well, thank you all for your attendance, and Laura will be sending out the invitation for the intermediate TriNetX webinar. All right. Thank you, Ashley. Thank you, Laura.
Thank
Thanks,
you all. Great day.